Can you just give me a notice when I have 2 minutes left?
Sure.
Hi, I'm Carla Densmore, Program Coordinator with Hepatitis Outreach Society of Nova Scotia, so we just shorten that to HepNS usually. And progressive glasses just didn't work for me, so I will have to, you guys are going to be blurry so I can read my notes, so if I look a little fuzzy, that's why. Okay, so I'm just going to talk about our Youth Safer Tattooing and Piercing project. And we shortened that to HIP, not HAP, so we're big on shortening things. And that's a project that's been going for 2 years. It wraps up the end of March. It was funded by Public Health Agency of Canada. So basically, we were developed some programming to go into junior and senior high schools and do presentations about safer tattooing and piercing. And most of our work was done in junior and senior high schools. We also went out into community groups and did some presentations as well. And we also did a Train the Trainer module that we worked with different people in public health, teachers and nurses, and shared materials with them so that they could do the presentation in their locations as well. And it went really well. We basically have reached about 3,000 people with our presentations. Part of the component was a little pre and post questionnaire that we did with participants, and we had some demographic questions and some research questions on there. And so we have about 2,000 of those forms were completed with youth in Nova Scotia. So in the next month, we'll kind of be compiling that data, and we hope to get some pretty interesting stuff about what's going on with body art and young people in Nova Scotia. And of course, we will share that with everybody. We did have a lot of young people involved in developing the program. We had a youth working group at Duncan McMillan High School that worked with us. We also have a HepNS youth representative, Amanda Smith, who's 16, that has worked with us as well. And we had youth reps on our advisory committee, so they've been involved throughout the course of the project. In addition to the presentations that we did in community groups and high schools, we also had some great opportunities at specific events to have a presence. So I don't know if you're aware of Teens Now Talk magazine. They had an expo in 2011 that we had a table at. So there was about 1,100 young people, parents and teachers that were at that expo. So we met with a lot of people there, and we really got some good information out there about tattooing and piercing. One opportunity that came up that turned out to be really great, Jared's Vision did a national Hep C conference for youth in December in Ottawa, and I was invited to speak at that conference. So it was about 100 young people from across the country and about 28 people from the Maritimes. And there's a school, Lockview, that we worked close with over the last year. They actually had 12 students went up to that conference. So we were really glad to be able to go up there. And one of the things we did was we actually compiled and modified some of our presentation materials, and we did training sessions with the youth at that conference about peer delivery of our materials. And this nifty thing is a 1 gigabyte USB thumb drive with our branding on it. And we put those materials on the thumb drives, and we were able to give them out to all the young people at the conference. And they were really, thought that was pretty cool. So one of the things is when they left the conference, they had made a commitment when they went back to their home communities to do at least 3 peer education events around hepatitis. So that was very cool. I pressed the button.
Oh, good, thank you.
So Lockview, we just heard last week that the students from Lockview High School that had been at that conference were being involved in doing an AIDS Awareness Week in April at their high school, and they decided to put in hepatitis information as well. And one of the students there has developed a video, and there's some really cool stuff that they're going to be doing, and we're going to go over and be involved in that too. So a lot of great stuff sort of grew out of that opportunity to go to that conference. and that was unexpected bonus for our project. And so our 2-year funding wraps up the end of March. And since we had such a great response to the project, we applied to get an extension on the funding. And we did find out just last week that we have a 1-year extension on the Safer Tattooing and Piercing project. Yay. So based on the first 2 years of the project, there was a few things that we wanted to tweak with our 1-year extension. So one of the things was that even though HEP&S is a provincial organization, it just seems to work out that a lot of the programming happens around HRM, you know, with your transportation budgets and ease of access and things like that. So one of the things we plan to do during the 1-year extension is to make a real effort to get out into the more rural areas and the other parts of the province. And that's been built into our transportation budget and hotel stays and whatnot. So that's one of our goals for the next year. And then since it turned out so well to go to the Teens Now Talk Expo and the National Hep C Conference in Ottawa, we decided to put more effort into sort of community events or science fairs in the schools, like that kind of event situation. And on the first 2 years of the project, we did try to involve youth as much as we possibly could, and we're just going to try and extend that even more in the 1-year extension. So when we do contact a school to go in and do some presentations, we're going to make an effort to hook up with a couple of young people from within the school, maybe who are already active in the Youth Health Center, and get them to work with us in doing our presentation in the schools. We were fortunate that we also got upward extension on the Hip-Not-Hap to be able to buy 300 of these wristband thumb drives. So we'll be able to load our peer educator materials on those. And so for the next year, when we do go into schools to do the presentations and to hopefully work with youth facilitators in the schools, we'll be able to leave the thumb drive with the presentation material for them to do peer education after we're done. Okay, so how many minutes do I have left?
Maybe
All right. Okay, so the people in my staff and people in the office just did a little brainstorm about the questions that were posed when Alexander sent the email around. So we did have a few things that we kind of learned over the last couple of years being in the schools. One of the things is the school's curriculum tends to have something on health and sexuality, or something's in the curricula there, but normally they've covered HIV, but nothing about hepatitis C. So what our challenge has been to kind of graft the information that we're giving on Hep C onto an existing knowledge base on HIV. So we mention HIV quite often in our presentation, even though we're focused on hepatitis, but what we're doing is highlighting this is how hepatitis is similar to HIV, or this is how hepatitis testing is different from HIV. So we're trying to take advantage of the prior knowledge there. We found sometimes when there's prior knowledge or life experience that it leads to confusion. So there is a vaccination program in the schools, and the young people get vaccinated for hepatitis B. But a lot of them are confused and think it was for Hep A, B, and C. So we have to go back and go over that. A lot of young people are surprised to hear that when they have yearly blood work from a checkup, that it doesn't automatically include, HIV, Hep C, STIs. They're surprised that you have to specifically ask for it. So in one way, it's an advantage when they're aware of something and they know what's going on, but then there is misunderstanding about exactly what it is. One thing that we realized, if we're talking about HIV and Hep C in the same presentation, if we just say HIV and HCV, it's very easy for people to get them mixed up. So we just always say Hep C now, we don't say HCV when we're doing presentations. Harm reduction. A lot of our talk is about we're discouraging people from having tattoo parties at home, getting tattoo kits off the internet, piercing each other's ears, like we're encouraging people to go to professional studios. We talk a bit about the Body Art Act and the licensing that's going to be coming in. But we have had requests from a lot of students to say, like, yeah, we hear what you're saying, but if we do it, how do we be safer? So that's definitely something that we're going to beef up in the next year, is some harm reduction on if you do these things at home. Some suggestions about being safer. And I have a feeling I'm probably out of time.
Burning point?
Okay, let's see. One big challenge with hepatitis is World Hep Day being July 28th, which is the summer, so it kind of cuts us out of school-related activities. But a lot of the schools do something about AIDS or AIDS Awareness Week throughout the year. So we're thinking about trying to graft onto the activities they already do for AIDS. And then as far as integrated approach and what's the best way to do that, I guess one of the things that we've thought is that presentations should be tailored to your audience. And we've just spent the last couple of years sort of building a repertoire of presentations that, we're working on one with Healing Our Nations for Aboriginal peoples, and we have one for youth, and we're doing co-infection Hep C, HIV that's targeting minnow sex with men, and another module that's for people who are HIV positive. And so I guess I'm thinking that most of our presentations are kind of living materials. And sometimes, like we had a meeting last week with someone from Addiction Services about an IDU module, and we went through the slides, and there was one particular slide that he thought would be a trigger for people who are in recovery. And so he said, if you come into our organization, can you just delete that slide? And we're happy to do that. It's easy enough to hide a slide. So I think where we're going is specific modules for specific populations, and even how simple it is to tailor something for a specific presentation. And that's all I have time for. Questions? Actually, one more thing about young people. They really love these t-shirts, and they love the thumb drives and the freebies. And whenever we want to get them talking and giving us suggestions, tapping into creativity is a really great way to do it. So if we give them some materials and say, how can we improve these? And we say the t-shirts, and they say, oh, fluorescent green. Like anything that gives them choices and can give them a chance to be creative. And like the students at Lockview that are creating a video for YouTube, that is what seems to really get their involvement. Okay, now I'm really done. Thank you.
Great idea.